in the 2 weeks from the 30th of December to the 30th of December, the UK case rate increased by 70%. And as you can see from these two graphs, one of which is from the middle of December on the left, and one on the right, the map, is from the 30th of December. The darker colours are areas where there are very high rates of transmission. And as you can see across the whole of the UK, there has been a steady increase in the rates. Next slide, please. These are the most recent data from ONS, the Office for National Statistics. What this shows is the number of people, and they do this on a random sampling basis, so this is a good estimate of the general population. And this shows the data from August, when we actually had very low rates. So in the middle of September, for example, 1 in 900 people had rates. Then an increase, the lockdown was brought in, and that brought down the rates. But then we had the problems of the new variant, which I'll come on to in the next slide, and the worst period of winter combining to lead to a significant increase since that time. And we're now into a situation where across the country as a whole, roughly 1 in 50 people have got the virus, higher in some parts of the country, lower in others. But 1 in 50 is really quite a very large number indeed. Next slide, please. If we look around England, what we find is that in every area, there has been a relative increase in the new variant of this virus that is spreading around the country. Fastest increase in the east of England, London and the southeast, but it is now taking off in other areas as well. In some of the areas where it took off to the highest level and Tier 4 was brought in during a period when schools were closed, there may be some early indications of some levelling off, but I think we shouldn't overinterpret that. But it is really clear that this new variant has been rising in all parts of the country, and what we've seen is that the bits of the country which have got some of the lower rates and had previously controlled things, particularly in the northeast and northwest, for example, the rate of increase has, in many of these, been higher than in some of the southern areas, which have got very high rates already. Next slide, please. And this is inevitably translated into new numbers of patients going into hospital. So these are the number of people in hospital all the way from the 1st of April through to the 1st of January. And you can see the first peak of people in hospital then decreased due to the remarkable efforts of everyone in the country during the first lockdown and then through the summer months. An increase which then again went down due to the second lockdown, but now really a very rapid increase, and I don't think you need any modelling to see in what direction the number of hospitalised patients with COVID is going, and this is going up very rapidly, and of course we are still in the middle of winter. Next slide, please. And sadly, of course, some of those people go on to die. This is the number of deaths of people who had a positive test result, and there was an increase which led to the second lockdown, a decrease following that, but these numbers of deaths are now increasing again. They are, at this point, quite a long way below the first peak, and there are 3 reasons for that. The first of which is very good news, is that doctors, nurses, medical staff in general are able to manage this disease better than they did previously. Better drugs, things like dexamethasone, but also better treatment all round. The second reason is that there is an age effect, that some of the people who are being infected at the moment are younger age than in the first wave, but this obviously, what we've seen previously, is it moves up through the age bands over time. But the third reason is that deaths are much delayed. So what happens is people get infected, there's then a delay before they get ill enough to go into hospital, and then there's quite a long delay before some people sadly die. We will unfortunately see, because of the spike in people going into hospital from the last slide, we will inevitably see an increase in number of people who die of this disease as we go into the rest of January.